I love the information on your website, and I love how it details your backstory that we just kind of briefly covered. You mentioned metabolic syndrome. Can we talk about that? Explain what that is, because it's not just a one thing. My understanding, it's a multitude of symptoms or diseases that can impact somebody. So, what is metabolic syndrome?
Right. So, the metabolic syndrome and metabolic health is really at the root cause of most of the chronic diseases that we face. Things like heart disease, diabetes, stroke, Alzheimer's disease, many forms of cancer. These have all been related to the metabolic syndrome. So it's important that people understand what it is, how to measure it. Because one of the other issues that we have around our health is that most doctors aren't measuring the right things. They're not looking at the right things. Many people make assumptions about their health based on things like their weight. And they say, well, I'm not overweight. I'm not that overweight. So I'm healthy. I'm not having I'm not having chest pains. I'm not overtly diabetic. So I'm healthy. But metabolic syndrome really underlies our health problems, and therefore it's important to know what it is and how to measure it. And what the metabolic syndrome is basically a constellation of numbers, tests, measurements that we look at to determine if your body is working the way it should, if your body is properly processing all of the inputs that you're giving it, and these are mostly in the form of the food that we eat. So specifically, when we're determining if someone, is metabolically healthy, if they have the metabolic syndrome or not, we look at 5 measurements. The first measurement is something you can and should check at home. It's your waist circumference. Very easy. All you need is a tape measure. You measure just above the level of your belly button. First thing in the morning is the best time to measure it. And if you are male, you want that to be less than 40 inches. If you are female, you want it to be less than 35 inches. The next measurement is your blood pressure. You can also check this at home, get a home blood pressure cuff. Almost every pharmacy, grocery store, has a little kiosk these days that you can go and get it checked. And pretty much every time you go and see a doctor, you're going to get your blood pressure checked. And the goal there is for your blood pressure to be less than 130 over 85 without the use of medications. If you've been told that you have high blood pressure and you've been started on medication for that, that's an indicator that you are not metabolically healthy. The final 3 measurements come from some basic blood work. And again, this is common blood work that you're going to get checked as part of a routine physical. You can go online to many websites these days and request it, check it yourself if your doctor hasn't ordered it for you. You want to look at your fasting blood glucose level, the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours. And that should be less than 100 milligrams per deciliter, which is the units here in the United States. And again, that needs to be without the use of medication. So if you've been diagnosed with type 2 diabetes, if you've been, started on medication to lower your blood sugar, another indication that you are not metabolically healthy. And then finally, we look at the cholesterol panel. And, cholesterol seems to be what everyone talks about these days. Every time you go to the doctor, they're going to talk about your cholesterol level. The thing is, when most doctors refer to your cholesterol level, they're referring to one number on that panel, your LDL, low density lipoprotein cholesterol, what they'll call your bad cholesterol. Turns out that number does not relate to your metabolic health. We don't look at it. We look at 2 other numbers from that panel that tell us about your metabolic health. We look at your HDL cholesterol, what's always called the good cholesterol. And it's called the good cholesterol because you actually want more of it. This is confusing to a lot of people because they're always heard you got to have your cholesterol lower. But HDL cholesterol, you actually want higher. Specifically, if you are a man, you want it to be over 40 milligrams per deciliter. If you are a woman, you want it to be over 50 milligrams per deciliter. And then finally, we look at your triglyceride level. And this one, you do want to be lower. The official criteria is less than 150 milligrams per deciliter. So you look at those 5 numbers, and if 3 or more of those are outside the healthy range, you are diagnosed with the metabolic syndrome. It's actually a medical diagnosis. And what it means is that you are at high risk of developing all those other things that I talked about: heart disease, stroke, Alzheimer's disease, many forms of cancer, all related to the metabolic syndrome. So it's very important to check those numbers. Now, I referred to a statistic earlier. This comes from a study, looking at adults in the United States. The data is actually from 2016, so it's older. And at that time, 88% of the adults in the United States could not meet all 5 criteria of metabolic health. So in other words, only 12%, about 1 in 10 of us, is in optimal metabolic health. And there have been other studies that suggest that the numbers have gotten even worse since then.
Do you know any? Go ahead.
I was going to say one other important part of that data, however, is that just because you are not obese, you are not overweight, it doesn't mean that you are metabolically healthy. In that study, the people who were considered normal weight, only 45% of them were metabolically healthy. So in other words, more than half of the normal weight people are not metabolically healthy. And that's an important assumption that is wrong. That is, if you are not overweight, you are therefore healthy.